So we're going to start this cosmetic rhinoplasty. Again, a revision one. Patient had the surgery a few years ago in another city. Now we're going to be improving the shape of this nose. She also has breathing issues. So technically this is more of a septal rhinoplasty. You can see the dorsum is broad. The nose itself is broad. And we're going to be addressing that. We're going to be making her nose more feminine. At the same time taking care of her breathing issues. If needed, which is most likely going to be, we're going to be harvesting rib 2. So we've just completed with this revision cosmetic rhinoplasty. So we're going to show you how broad that nose was before we started. We've not only narrowed it down, we've slimmed it. We've also given it a better shape. I'll show you the side view. Okay, and eventually the basal view. And that was before and now.